Good morning, everyone, and welcome to Auntie's webinar about how to cope with adversity. Some practicalities before we begin. Your microphones are on mute. The chat box is available should you want to give any ideas, thoughts, concerns about the topic. And if you want to leave us questions that we will discuss in the end, please use the Q&A box and we will pick the questions at the end that we will go through. So our topic for today is how to cope with adversity. So we are like, well, no, life throws everyone different sized and different looking adversities, and both in the private and professional spheres. And today we will be tackling this topic on how to manage these situations in the most proactive way. Our professional today is Hanna-Kaisa Raninen, and we will try and keep this in the time frame allocated for this one. So we have 30 minutes. So without further ado, Hanna-Kaisa, stage is yours and we will enjoy the show.
Thank you, everyone, and hopefully you can hear me okay and see me okay. If any technical difficulties, then please let us know and we'll try to fix it. But today our topic is how to cope with adversity, and firstly I want to acknowledge kind of the different reasons people are maybe here today, this morning. So you may be here listening while going through something very difficult at the moment. And I'm always very, very humble to speak about these issues with you guys with something like this. And also there may be listeners at the moment who are not themselves struggling, but are seeing a loved one or a colleague or somebody close to them struggling with something difficult and kind of want to have some tools or kind of have a conversation about how to help those people around them. Or maybe you're in a pretty good place right now and just kind of looking for ways to cope and deal with things once they come along, as life inevitably throws things at us from time to time. So now is a good time, of course, in those situations to listen and kind of preemptively store these things that you're going to hear today for future reference. Shortly about myself. So my name is Hanna-Kaisa Raninen and I work as an Auntie professional, and my background is in business, in exercise and sport psychology, that I also teach, and cognitive short therapy and acceptance commitment therapy are kind of the methods that I work through with my clients as well. And today our agenda is kind of going through the different coping mechanisms, different feelings that these adversities, hard times, tough times can have on us. And then we'll look all of this through the lens of ACT. So ACT is acceptance commitment therapy that is guiding the work of us professionals at Auntie as well. So we're going to look into more of what that is, and just looking into how to deal with hardships, difficult moments of every size, and kind of also those everyday annoyances, so smaller things, how to deal with those thoughts and feelings that they kind of that come up with those things at the workplace or at home. And then, as Mikael said, we have then time for questions and your comments in the end. But maybe we'll start with a check-in of how you are doing this morning today. And thinking about kind of the topic of today as well, thinking about the past week, what type of hardships have you faced during this week? So just thinking about kind of for the past few days, what has been difficult? They can be small things, everyday things, just those small annoyances, or even bigger struggles that you're currently going through. And then taking a longer perspective, how are you what type of hardships and things have you faced within the past 6 months? So year 2023, what has been going on when you think back? And it can be hard to kind of go back and think about those, but just kind of try to take that perspective. How about within the past 5 years? What type of hardships have you faced? What types of ups and downs have you experienced? Or even during your whole lifetime. So we all face, most of us, many difficult times. Some people kind of go through life with not facing too many hardships until adulthood, and some people then face many things already as very young people. So we cannot, of course, choose what we are dealing with, but those kind of adversities for in many shapes and forms are familiar for all of us. But kind of keeping this in mind. So later we'll go into thinking about your coping mechanisms and what are the things that have helped you within those times, and what are maybe the things that you now, looking back, taking that perspective, can think that were not so helpful, or something that you maybe would like to then do differently next time. But let's get into it, how to cope with adversity. And just firstly, looking at kind of most common reactions, emotional reactions, and then coping mechanisms when we face something difficult. Emotions, of course, can be very varying. So here are just kind of a few examples of the emotions. So, of course, the most common ones are that we feel fear, we may feel angry about the situation. Maybe we feel that something has been taken away from us that we cannot get back. There is, of course, sometimes behind anger, there may be grief about the situation, feelings of anxiety and worry about the future. How is this going to affect me in the long run? Is this going to end at some point? Sometimes these things are kind of small annoyances that we already see kind of the end. And sometimes things are very uncertain and we don't know how they're going to end and when. So feelings of hopelessness and not really knowing what is going on. And we may then react differently regarding a different situation. And of course, depending on our temperament, our personality, the things that are happening to us, what is kind of the first reaction, emotional reaction that comes in those cases. And here we're going to go through some common coping mechanisms. And I'm just going to put these all in here so we can kind of, talk about them here at once. So just a list of most common coping mechanisms, kind of rationalizing things. So kind of explaining things for the best is one coping mechanisms. And some of these can be very useful and kind of good for us. And some are kind of something that we may need at the moment, but in the long term, we kind of start to feel the effects of these coping mechanisms that maybe it's not so functional anymore in the long run. So for instance, rationalizing things is something that can bring us comfort and safety, and it's a very good thing. We get to kind of think about it in an objective way and kind of take that helicopter view of our life, that how things are going, take that perspective. But then if we try to rationalize for too long, it can kind of also then turn into dwelling and worrying about things if we are just using this as our only coping mechanism, and kind of also pushing the difficult feelings aside and not really accepting them as they are. Then, of course, avoidance is something that we try to avoid these feelings, difficult feelings, and we can do that in many ways. Addiction is one. So we are addicted to many things. We can start overworking, just kind of gathering a lot of things to do so that we wouldn't have to face what is going on. And of course, this coping mechanism as well has its upsides and downsides. So it can be good for us to take our mind off things for a short period of time. But if that continues and continues to be the only coping mechanism, so then it can turn into a very unfunctional one as well. And then, of course, addiction, food, drugs, alcohol, those type of things, of course, very familiar for many of you as a topic for sure. And rage, so we are kind of turning it outwards in some way. We're feeling very angry. And kind of behind the anger can be grief about the situation as well. Or then kind of this excessive positivity and vigor that I'm just going to push through this as I've done before. I will get through this. And as I said, can be very good as well. But then if that kind of leads to this excessive, almost toxic positivity, nothing's wrong, I'm going to get through this. So kind of the acceptance phase of those difficult feelings is passed aside. So then that can lead to then kind of not really coping or prolonging kind of the process of grieving whatever is going on. Kind of now taking a time for yourself to reflect those difficulties that you have faced in your life. So think about kind of what type of strategies have you used to deal with those difficult feelings, loneliness or grief, anger, anxiety. And taking kind of this functional analysis point of view is very useful in many cases in our lives to kind of look into the functionality of these coping mechanisms and strategies. So have these helped you in the short term? So did they alleviate these feelings? Did they help you? And now when you look into them from this perspective in the long term, were they also helpful? And kind of if now you can think of things that kind of would help you in your well-being today. So sometimes it's good to kind of reflect back and see what things have worked in the short term and how about in the long term. And sometimes those things that help us in the short term are not the same things that help us in the long term to cope with adversity. And this is something that you can take with you from today and kind of do this analysis from time to time. But just shifting gears for a little while here and going with the topic of how to deal with these everyday annoyances that we all face. It can be something going on at work or something that really kind of just stirs up many difficult emotions and kind of it's very hard to deal with those things. And sometimes these are situations, other people are annoying us, other people are maybe making decisions around us that are not kind of good for our well-being or we're affected by them in some negative way. So how to deal with those things? And sometimes if we're taking a work setting as an example here, we're going to face difficult feelings, but we're not able to deal with them immediately at work because we have to be in this work role. But here is a good list of what to do to deal with those everyday feelings that come up that can be difficult and cause suffering. So first is to stop. When you notice maybe the feelings coming up, maybe you notice even physical reactions, some pressure in your chest or a headache or your heart rate going up or your palms sweating or something like this, then it's good to take that as a signal to kind of stop and breathe. And it's good to take a moment and then go over kind of what happened, what caused this reaction. So kind of this chain analysis. What happened? Of course, maybe thinking about if I'm tired at the moment, have I eaten? Have I been taking care of my routines that I know that will do me good? So also going a little bit further to see that why am I so triggered by this at the moment? And sticking to the facts. So of course, many times when something like this happens, that stirs up emotions, we are so caught up with our emotions that rise up really quickly, and we don't have too much control over them. It's good to stop and kind of look at the facts kind of as an observer point of view, taking that helicopter view from above and kind of observing that what actually happened. And then a good thing in this overall theme that we are going through today is the second one. So it is very functional in many situations. So that's reflecting and kind of separating the things that you can do and you can control and things that you cannot really control at all. And focusing on the things that are under your control in this situation. So maybe the only thing under your control in a situation like this is exactly going through the list here. So stopping, breathing, going for a walk, calming down your own emotions. But if there is something that you can do, so then kind of thinking about a to-do list or plan on how to deal with this situation. So that's of course very functional as well, if there is some list of things that you can do to kind of advance the issue. But then if there's nothing you can do, it's good to, as we'll go on further to see, to recognize and accept the feelings that you're having and think about what would help you right now. I was talking about going for a walk or doing something physical or just kind of changing the scenery a little bit. If you're sitting down, standing up, for instance, going from one room to the next or whatever would help you in that moment, taking a break or drinking water. And then, of course, at work, at a work setting, not taking the annoyance out on your colleague, but kind of maybe establishing a boundary that you're having, taking that break, coming back with a more neutral mindset of making a request or a wish about the matter, that maybe in the future we could deal with this in a different way. But then we'll go on and kind of go through ACT as a guide during tough times. So ACT is acceptance and commitment therapy, and we'll go through it in more detail in the next slide. And this is in reference to Pietikäinen, so Finnish psychologist who has written many books about acceptance and commitment therapy. In English, for instance, Russ Harris has written The Happiness Trap, a very similar book that I sometimes recommend to my clients as well. So there are three parts here. So first, recognizing the fact that you had faced something difficult, that it hurts. So kind of accepting and facing the situation at hand. So turning your face in a way towards it. And then turning towards difficult feelings and thoughts. So kind of facing them with compassionate acceptance. And we'll go through that in detail in the next slide. And then commitment in ACT comes from committing to your values. So committing to the things that are meaningful to you and yourself and your well-being. And despite those very difficult feelings, despite the suffering that is going on, that you would still be able to commit to things that you know that in the long run will help you. So here is kind of the path to acceptance according to ACT, and this is in reference to Pietikäinen as well. So the first part here is self-compassion. So kind of turning your mind into thinking in this difficult situation that you're in on how to treat yourself in a compassionate manner. And kind of now thinking about what would be something that you would want to say to yourself that would be compassionate, loving, somehow would soothe you, would help you. So turning kind of those very critical thoughts into something more compassionate. And sometimes here, there are also those critical thoughts and thinking. And it can be hard to turn those thoughts off completely, but trying to activate also this other side this self-compassion, and we're going to do a small exercise on that on the next slide as well. So many times when we're facing something difficult, so another part of the suffering is that when we're facing something difficult, we're also at the same time demanding of ourselves to be as functional, to be as effective, to do things in a similar manner that we would when we were, let's say, in a more neutral, normal state. So self-compassion is accepting the fact that this is not possible at the moment. I'm not going to be as functional as I would be, let's say, at work. I'm not going to be able to deal with things as effectively as I usually would, or sometimes maybe my emotions also take over, and I'm going to be sadder or more angry than I usually would be. So also being compassionate towards those feelings. And with self-compassion, of course, it usually helps to think about what you would say to a friend or a colleague if you would kind of hear their inner thoughts and what they are thinking and saying to themselves. So what would you say then? Probably something very encouraging and hopeful. Then mindfulness skill is next. So this is mostly in regards to physical reactions as well. So being mindful of where you feel these feelings in the body, and should I stop now and breathe and kind of take a few deep breaths to feel better? And how do I kind of deal with my difficult emotions? And sometimes it's good to go outside for a walk and just kind of smell the air, look at the surroundings. If our mind is very much in the worrying cycle, maybe then bringing the attention to the present moment and just kind of in an accepting way observing the environment, observing the sounds, the smells. It's not a trick that would suddenly take everything away that is difficult right now, but it probably will alleviate some of the worrying, some of the kind of mulling over things over and over again that is adding another layer to your suffering. Then acceptance of emotions. So kind of all of the difficult emotions that you're having, that you're facing kind of towards them. And we know that kind of according to many studies, accepting your emotions promotes well-being and kind of recovery when you're connected to your own feelings, and especially during a crisis. Kind of noticing what is happening, maybe giving the feeling a name. So first noticing the feeling, then giving it a name. This is sadness, for instance. Then maybe locating it in the body. Where do I feel the sadness? And then kind of remembering this even when the strong feeling subsides. And it's good to remember that it will subside in time as well, that this is not a permanent state. Then also accepting reality. So accepting what has happened. So this is something that happened. It cannot be kind of taken away. I cannot go back and correct this situation. So accepting the facts as they are. So kind of radically accepting what is going on at the moment. Also accepting your thoughts. So the thoughts, as I said, in self-compassion point there, can be something that are demanding more of you, can blame you about the situation. You can have many types of thoughts that are not very constructive or helpful always, but just kind of noticing those thoughts rather than being fused with them completely and believing everything that the mind is telling you, but just noticing that this is something that my mind is now producing at the moment. For instance, something that I'm a miserable person, I didn't do well, my life is ruined, all of those types of thinking. It's kind of good to recognize the thoughts, maybe to see them as clouds in the sky, kind of going, yes, this is the thought that I'm having, and this is the thought that I'm having as well. accepting them as they are. These are the thoughts at the moment. Maybe talking with somebody about them as well. But it's kind of good to then take some distance of those and return to part two. So doing some mindfulness in that way, that coming to the present moment and coming from your head to observing the environment around you. Then changing perspective, so kind of taking a helicopter view of your life, of perspective, what else is going on. When you see the landscape, you go up and you see the whole landscape of your life. What else is going on in your life than this suffering at the moment? What are maybe the things that bring you safety? What are the things that are constant in an uncertain situation that you can see from the helicopter view? Some things that are constant, some things that you can lean on, some things that help you. So this is very useful. And sometimes we need help from another person to really get there. Then forgiveness and letting go. So forgiving yourself. If you're blaming yourself, it's always a process, of course, maybe forgiving the other person who has hurt you in some way. It doesn't mean that you would accept their behavior or the situation even. The forgiveness is always kind of done for yourself to alleviate your feelings, to increase your acceptance of this situation as well. And it allows you to kind of mourn what was lost, maybe in that situation as well. And helps you to kind of accept your thoughts and feelings and then to let go and focus on the future rather than focusing on kind of worrying about the situation so much. That will happen, of course, as well, but also it helps you to turn your attention towards those functional coping mechanisms that help you move forward in the situation. And just a short exercise in self-compassion. So you can do this now. It's very short. Screenshot or take it with you. So placing both hands on your heart, breathing calmly a few times, and saying these words kind of out loud or in your head with compassion. So I've been through a lot in this situation. I'm facing difficult times. I'm not alone with these experiences. There are other people who are facing these similar hardships from time to time. And I want to offer myself safety and consolation. I want to treat myself in a friendly manner. And I want to commit to those things that make me feel better. And then breathing again a few times. Just to end our presentation today, it's good to remember 3 things here. So kind of according to acceptance commitment therapy, connecting to your values. So remembering what is important to you. What are your core values that you want to live by? And maybe doing 3 things according to your values every day. So you can sometimes, I also give my clients tasks such as this to do 3 things that they find meaningful in every day. Then taking care of routines is very important. I know many of you and most of you, all of you know this already. Taking care of your eating and sleeping habits, taking care of your basic needs. So just really that brings safety within times of uncertainty, that you can lean to those routines that can support you. And then social support, so talking to a professional if needed, or sharing with a loved one who is a trusted loved one or friend to support you, so we don't need to go through this alone. And just summing it up here, kind of an ACT perspective for coping with adversity. Good. And thank you.